Welcome everyone to another episode of A Message for Her.
And a lot of women don't necessarily understand where to go when they are kind of starting to identify that it's like broken.
Okay, so why do you think so many women suffer in silence when it comes to pelvic health? And today I am overly excited, which is like almost every episode, because I not only get to sit with a friend, but I also get to sit with a physiotherapist. And today the intent of this episode is for you to reconnect with your body without shame. And then we get to look at some of those things that you have normalized, and you don't have to normalize it. That way you are informed and you still get to make choices. So allow me to introduce my very good friend, Kayla. She gets to sit with me in conversation, and I'll let her introduce herself because I do not want to butcher most of the stuff, but I have great questions for her.
All right, so my name is Kayla, and I am a physiotherapist here in Sudbury, and I've taken a lot of continuing education courses, basically to now be able to call myself a pelvic health physiotherapist. So basically I treat men, women, and kids kind of all through the spectrum, all ages. But I will say the bulk of my caseload is with women's health, and that truly is where like my passion lies. So I'm excited to talk about it today.
Thank you. And I was going to say that confession time.
Yeah.
Do you know that? It is so embarrassing, but I have to say, even when when you hear pelvic health, right, I'm thinking women.
Yeah.
Right? Because you hear women are the ones that are most talked about, like, oh, your pelvic floor, this. That, like, I throw away everything I've learned, even in nursing school, that I'm like, it's women.
Yes.
But then it's so great because it also integrates everyone. But then today we're going to be selfish. Okay? We will talk about women.
As we should.
So, I'm going to get into it. So, my first question, from your experience, what are some of the things that women commonly normalize about their bodies that they don't actually need to be normal?
There's so many. I'll say from on a day-to-day, there's a few really common things that pop up in clinic. I'll say one of the main ones is peeing when you laugh. Or when you jump. That is like, oh God, I would say at least like 90% of the people I see are dealing with some form of urinary incontinence.
Yeah.
So that's a really big one. And it's not normal, but it's incredibly common. And I like for people to know that it's like you're not broken if that's happening, but it's something that a lot of people just deal with. We do the, crossing of the legs, and it's kind of just this like thing that women do now, and people don't even bat an eye at it, but it's fixable. Another one that a lot of people deal with is like pain with intimacy.
Yeah.
And I find that's a really hard one for a lot of people to talk about because we have this like social pressure to just be, sexy and perfect and whatever, and nobody wants to say like, oh, actually like it hurts and I avoid it and things like that. So I find a lot of people have a really hard time talking about that when they come into clinic. But yeah, the one other one that's really common is constipation.
Oh my God.
That's an easier one to talk about. But yeah, basically people just don't poop enough, and it causes a lot of other issues within their pelvis. So a lot of times, I will say at least 10 times a day, I talk about pooping with my patients, and they all kind of giggle and look at me funny, but it's really important.
Right. And it's like, I love that it's almost, you've normalized it for me. And I'll say that before I went to nursing school and I had met like my husband, and I remember just saying, how do you poop like 3 times a day? Because I was just like, I don't get it. But it was also that lack of knowledge, right?
Yeah.
Where I thought like, I could be gangster. Like, I only go to the bathroom like once every 3 days. And I was like very happy with that.
Yeah.
Because I was like, I could totally plan to go, because I'm like, I have certain rules. I'm just like, I'm not gonna go to the bathroom in anyone's house. So if I'm going somewhere and it's like a 2-day trip, I'm like, I'm good.
Yeah.
I'll be back. But then now learning about it and some of the things that it affects our bodies.
Yeah.
And I think it was just that lack of information and what it does to you, and not knowing that you can be able to fix it.
Yeah.
And then talking about the other point you had made was like laughing and peeing at the same time. Or like those things that like incontinence, like for me, you would think, oh, it's gonna catch people when they get older.
Yeah.
Because your muscles get looser. But like these people that are like
Mm-hmm.
dealing with it right now, and then you just think like, who am I gonna talk to? Either shame is like the one thing that just like kills everyone. And depending on where you're from, even if you come to a place where you're like, oh, I could literally get help for this. Sometimes it's gonna take like a lot to get out of that shell. But I love that Kayla has like this amazing Instagram page that she like has normalized a lot of things, even for me, that I'm like, oh my god, like even talking about sex and like it's very taboo. These are things that like a lot of people are like, this is personal, this is private. And then now with the republic of Instagram, where now you have people just telling you all kinds of things where you actually feel like, now I am a broken human being.
And I think that's the narrative for a lot of women, is that like, if we aren't perfect, we're broken. And a lot of women don't necessarily understand where to go when they are kind of starting to identify with this like brokenness, right? Like, I think a lot of people basically just like, I don't know, history has shown us that like, if we're not feeling well or if we're not operating well, we need to go to the doctor. And that's another big thing. A lot of my patients have seen, you know, a doctor, a urologist, like a gynecologist or an obstetrician. Like, they've seen everyone and they've done all these tests and they just can't figure out what's wrong with them. But at the end of the day, they come see me and we figure out it's actually their pelvic floor. Like, their pelvic floor is just not doing what it should do. And none of the other practitioners really know what to do with the pelvic floor other than, you know, operate on it or medicate it. Whereas like, there's things that we can learn in terms of like body control that can make things so much better.
I know, and wouldn't that be fun to actually to be a participant? And I'm like, this always comes back to like, in different areas of your life, you don't want to just be like watching, or like when it comes to intimacy, where now it just becomes about the other person, because you're just like, oh my gosh, I have to keep them, but this is terrible for me. So now you are like just there, but you want to be an active participant. So like, knowing about things like this is very empowering, and knowing that, you know what, I do have a chance, I'm not broken. And there's nothing like perfection, by the way. Like, we're all built differently, and exploring like this help will get you to discover like what you can to be better in whatever area, but especially with your pelvic floor. So I love this. This is like really great. Okay, so why do you think so many women suffer in silence when it comes to pelvic health, pain, and discomfort? Like, when all these things are happening with intimacy, like, you know, incontinence, and like, you know, constipation. Like, why do we just like
suffer in silence, right? I feel like there's so many things that could kind of explain it. There's so many perspectives, right? As a woman, I feel like our generation is doing a really good job of like learning to take up space and, you know, advocate for ourselves, but that wasn't necessarily the norm for all the generations before us, right? I feel like a lot of our moms, our grandmothers, our aunts just dealt with things, and it just became this like, okay, you have babies and you're gonna pee yourself forever, and and it's just kind of like this thing that they've told us, like, that's the reality. I've been doing it for 30 years. So then we're kind of like, oh, okay, I guess this is my new reality, right? So I feel like it's not their fault. I feel like the way society was kind of constructed at that point really made for, you know, a lack of care and a lack of education and just awareness for a lot of women's related things. So I think that taking up space is one of the big ones. Like, that explains why we you know, suffer in silence. But I also, like, a really big thing that I talk about is the fact that, like, our pelvis, or like the pelvic region, is often referred to as the private parts, right? So with the private parts, basically we're told that like we shouldn't show those things to other people, and we probably shouldn't talk about those things with other people. So even with our family doctors, sometimes people won't bring up these things. And I think truly, like, it's an area where a lot of things can go wrong. And so we need to, you know, as women or as people in general, just be able to talk about those parts and, you know, prioritize like learning what those parts are called and knowing how to talk about them. Because I'll say, like, for example, some people come into my office and they're so not comfortable with talking about their vagina. I don't know if I'm allowed to say
No,
that.
you're not to say that. These are like the normal terms,
Yeah.
and that's part of normalizing it, even when we're raising kids.
Yes.
Right? To say
exactly.
it's not a pee-pee,
No.
it's a penis.
But I have full-blown adults come into my office and talk about their pee-pee. And I'm like, okay, let's figure out what part of your pee-pee you're referring to here. Because, like, there's the vulva, there's, you know, the actual vagina, which is inside. And, like, there's so many parts to it. So I find a lot of part of, like, a big part of my job is just kind of educating so that we have the words to basically be able to describe what's going on. So that's a big barrier, I would say.
I don't even know if you guys can understand my excitement, because it's like she speaks to my soul, because the little girl in me, or like even in my adult years, like I even remember, like, you know, when you're growing up, because the way they grew up, and they're giving you what they have, right? There's the tools they have that we don't talk about, that it's private, which is great for safety. But then when it's like your practitioner, sometimes they need to know, and learning them the words to use is important. But then it was like, you know, when somebody is incontinent, as you say, like if you tell your mom or something, like, I do it, you know, I just go buy, you know, pads or something, right? Because that's just how it is. But then also the one thing that for me was that, because it's something we don't normalize, so even from cleaning a vagina and doing it right, you would think, oh, I need soap, I need this. But then it's like those things that a lot of women don't even know, that water is good enough.
That is,
and I learned that, like, and these are things that people have to discover for themselves. So I'm very, like, excited for Gen Z.
Yes.
They're like the generation that's shifting things for everyone. And I'm pretty sure it's also empowering, like, the older generation that has to deal with this. So it's like panty liners are uncomfortable too, because they come with their own problems. Especially if it's something that you can fix, then
that's the
I
thing.
don't want to deal with it if I don't have to.
Exactly. And a lot of the products that people have been using, like panty liners and pads and tampons, are full of products that are just not good for your body, that can, in some cases, dysregulate your hormones and, you know, cause other problems.
Yes.
So, you know, we're trying to mitigate one issue by just wearing a pad, but then we're kind of, in theory, potentially causing other
issues at the same time.
Unintentionally, exactly. So being a woman is
not easy. It's not easy at all. Sometimes now you're like, oh, okay, I'm mitigating this, and then now you have other problems. Now you have to take antibiotics, and it's not solved. But sometimes you can't even understand why that is happening because you don't know. So then you're in this circle that just seems like never ending. So it's very important for us to, like, have these conversations.
Yes.
And I love that. Again, I will repeat this, like, if you have not followed Kayla on Instagram, like, that's what you need to be doing if you're a woman, because it will change your life. And especially if you're somebody who's like, because again, it's not about shaming, and also it's about readiness and giving yourself grace to know that she's gonna be okay if you show up and say my privates, because she understands the journey. But also if you're saying, I understand what she's saying, but I think my stuff is, like, worse. I think she's had it all, and she can hold space for you to be able to, like,
I can
have
hold
those conversations.
Exactly. I can hold space, but the other thing to keep in mind is that as a physiotherapist, we're basically, patients have direct access to us. So if you decide that you wanted to go to physio, you can book a physio appointment, and you can see one within the next, you know, week or two, depending on, like, schedule availability. And a really big part of our role as healthcare providers is to be able to essentially decide whether or not you need to see a doctor for further assessment, or if you can continue care in physiotherapy. So we're in some ways triaging every patient that we see for red flags. So if we think that, for example, you might have all the markers for a potential cancer, or, you know, a big diagnosis that could explain what's going on with you, it's our job to kind of be able to say, like, okay, this doesn't seem like a muscle issue or a nerve issue or a bone issue. This seems like something bigger, and you need to go see this doctor.
This person.
And that's at that point, we'll, you know, write a letter including all of our findings, just to help support and kind of explain things from our perspective. So, like, in terms of like access to care, sure, there are still some limitations because with privatized healthcare options, basically there's a cost associated, but often if you have extended healthcare benefits, like that covers it. So I think a lot of people kind of worry about the cost, but I think in terms of like, you know, some people having to wait 4, 6, 8 weeks to get in with their family doctor about whatever concern, I think it's in some cases like applicable or valid to book an appointment with a pelvic health physiotherapist or a regular physiotherapist to kind of just get this like baseline assessment, and then they can kind of help accelerate things, right? So
no, it's perfect because also you get to, it's a place to start. It's somewhere where you can start where you're like, okay, I'm having all these issues, I'm not even really sure what I'm dealing with, and I'm gonna go see someone. And then when we talk about the expenses of it, we do understand that there's some people that cannot absolutely do it, right? And then I'm hoping that wherever you are, there's some support that you can get. For those that can and they're choosing not to, please choose yourself. Whenever you're ready, please do it. So like I love that, like I just like when you see Nikki looking, I'm like, oh, but I love her because every time you ask one question, she's gonna touch on like 7. So I'm like, this is beautiful.
I'm a chatty gal, sorry.
No, we're like, we met each other. I met my match. Okay, so how can women begin to listen to their bodies with compassion instead of fear or self-blame?
I think this comes down to this whole like just taking up space and just having some form of, you know, I guess accountability or something for being able to take care of ourselves, right? Like I think that a lot of people feel guilty for, you know, maybe not exercising or maybe not eating the things that they should eat or maybe not drinking enough water, and they kind of, when they come into my office anyways, will kind of be like, oh, I know I should do better. I know I could. And it's okay. Like, it's okay that you're not doing all of these things.
Not perfect beings.
Exactly. And often, like, when I'm talking with my patients, we talk about this, like, really gradual, really progressive, you know, increase in what you're doing. So if right now you drink 4 glasses of water a day, I can promise you that that's not enough.
Girl.
So, you know, I give people, you know, these little milestones to kind of work towards. And if we reach those milestones at the intended time, that's fine. If we don't, it's also fine. We'll get there at some point. So being so black and white with your health and with like how you perceive what you're doing for your body, we just need to be more gentle to each other, because like it's at the end of the day, when it comes to drinking water, like it's water.
It's water. It's not, doesn't taste good. No. I think that has been established. And if we look at all the things that are good for us, sometimes they don't taste good either.
Exactly.
But then it's like a weird question. Not weird, but like, okay, so if I'm drinking tea, does it count towards my water intake?
It does. Yeah.
Okay, so
does
like,
coffee.
You know what? We're doing well.
Yeah. At the end of the day, like if we talk about like your fluid intake just in general, so like anything that's liquid counts. But there are certain fluids that are a little bit more beneficial for, you know, accomplishing certain goals, we'll say. So like I would say if you're drinking coffee from morning till night, yeah, sure, there's water in coffee. Like it does count. However, there are some things that might work against you when it comes to, you know, the caffeine intake. That could be really irritating for your bladder or your bowel and, you know, might upset your stomach. It could cause urinary frequency. It could cause urge-related incontinence. Like there's things that we need to kind of keep in mind with the fluids that we are taking in. So I always try to tell people, like, just balance is important, and you know there will be days where you balance better than others, and that's okay. But as long as my my patients or clients leave the room feeling educated and like they've learned something, now they have the tools in their toolbox.
Yes,
and they'll use them when they use them. Right? Yeah. We don't use a wrench every single day.
No, some days.
Exactly.
Okay. So when we look at you're raising kids, I'm raising kids, which is the one thing that like we absolutely love it. Yes. Why is it important to talk about pelvic health across ages, life stages, and not just postpartum?
Okay,
because most of the stuff we think oh, I used to be great before I had kids. Now I'm having incontinence.
Yes.
Now this is happening to me after I have had kids.
Yeah.
So, but then it just doesn't happen for people. Some people are still single, very available and doing great, but then they experience all these different types of discomfort. So why is it important for us to touch on?
Well, I think because at any stage in life, lots of things can happen, right? Like we can be constipated in childhood, and that could explain why we're wetting the bed. And yeah, that's a really, constipation in childhood is a really, really big thing to kind of dive into, especially if there are, you know, some pelvic floor dysfunctions kind of going on.
So does this happen simultaneously when they're children? So they're constipated and then they're wetting the bed?
It's not necessarily always this like black and white or like big correlation, but if a child, for example, was once dry throughout the night, and then all of a sudden they've started to now pee the bed, we kind of want to look into why. So is there like a really big emotional or like anxiety piece that's going on with this kid? Did something happen in terms of like maybe abuse? Like I don't always love kind of steering it that way, but we got to kind of check it out.
You just have to look at the 360 picture.
Exactly. Or are they just constipated? Are they really backed up, and is that putting pressure on, you know,
their
certain parts? Exactly. So like that is a really big thing for a lot of parents that come in with their little ones, and I'm like, okay, when's the last time they pooped, and what's their poop like, what's their poop texture, right? So pelvic health for kids kind of comes down to more like, we'll say, I shouldn't always say that it's related to behavioral stuff, but behaviors can be big. So yeah, like things like that. And then we'll say like midlife, even with not having kids, like, I think that it's really important to just do a general pelvic health check, because like you could leak if you were, you know, let's say a sprinter, and every time you go for a run you're leaking. Okay, well, we can fix that, we can work on that, right? Like high level athletes and people like that can end up with certain pelvic floor dysfunctions that can be fixed. And then, you know, if we think later in life, when we come around like menopause time, sometimes there's some really big like hormonal reasons that we end up with these pelvic floor dysfunctions, and a lot of times in those specific cases it makes sense for us to, in some cases, combine hormone replacement therapy with physiotherapy to, you know, prevent things, or
so you can continue to live a fuller life, because then people just think like, oh no, I'm 60 now, it's going downhill from here. It doesn't have to be.
It doesn't have to be. And I think there's a really big menopause movement right now, which is lovely to see, because I think a lot of women have just been dealing with these like hot sweats and urinary incontinence and pain with intercourse and blah, blah, blah. And now we've kind of really come to a lot of really good conclusions. I shouldn't call them conclusions. We've got lots of more, or a lot
researcher,
more treatment
so these terms are gonna show up because she's a researcher.
Like there's just a lot more in terms of like care options, and people are seeking them a lot more frequently now, rather than just like, whoof, I'm having like a tropical moment right now kind of deal. So like, I think that's good. But yeah, there's a really big bulk of pelvic health physiotherapy that almost seems like just like has tunnel vision, we can say, for pregnant women and postpartum women. But like it's not just for them. Like it does help them a lot, trust me. But they're, you know, I think even me, in terms of like my Instagram page, I focus a lot on pregnant people, because I like, truly, that's a thing that I enjoy treating, but there's so much more that we can treat.
But then you can treat normal, like, you know, everyone is normal. Including you. That when I say you can treat normal people, I mean me. All right. Is there one mindset shift you wish more women could make about their bodies and pelvic health, and what would it be?
I think the biggest mindset shift that I would wish for people is that, you know, we stop viewing ourselves as being broken, essentially, because like truly we're not broken. I kind of sometimes will compare like certain situations to like your car. So let's say you have a car. It doesn't have to be a brand new car, but at some point down the line you'll probably get a flat tire, right? just like us. We could be fine our whole life, and then eventually our flat tire is maybe urinary incontinence, so we start leaking, right?
Yeah.
And that doesn't mean that we need to sell the whole car and restart from scratch, right? We just need to change the tire. And so like that tire being changed, in terms of like the analogy for the woman, we just like go to physio or go see a urologist or your family doctor, deal with that, and then your car will be working fine again, right? It's like, I think that sometimes giving that perspective kind of helps people realize that like, just because something's happening now doesn't mean it has to happen forever.
And my car can go in for service to maintain it.
Well, and that's the other example I give, right? Like people often ask like, okay, I feel a lot better now. Like, are we just done? And I'm like, we don't have to be. Like a yearly checkup is really not a bad idea. Come in, even if you're feeling fine. I'll do a full, detailed assessment, see what's going on. And if you're good, I'll see you next year. If there's something that we can work on, I'll see you next week.
Yes.
So that's the biggest idea, I think.
Okay, so the biggest message we have to leave with today is that our bodies are not broken. And half the things we're experiencing right now and we call normal, we don't have to normalize it, because what's the whole conversation if you're just catching the end? Because there's like a lot of things that can be fixed. But while I still have Kayla here, I have like things that I'm like, oh my God, I have to ask you this before she leaves. When we talk about bowel movements,
yes.
What is the normal, like the number that they're saying normal? Everybody's gonna have their own normal, but with a normal that is like, it's like, this is good.
In healthcare, there's always this like gray area. Everything kind of falls in this gray area. But usually what I suggest is somewhere between 1 and 3 bowel movements a day. And typically...
like 3 times. Who has time to go to the bathroom?
But that's the thing, right? So a lot of people think like, oh my God, 3 times. Like I sit on the toilet for half an hour to 45 minutes trying to get it out. Like that shouldn't be the case, right? So there's a lot of context in this answer. So typically I tell people that they should, shit or get off the pot. So don't sit on the toilet and scroll Instagram or, catch up on the daily news.
You know yourself.
Get off your phone. Sit on the toilet, do the deed, and within 5 or so minutes, you should be up and, resuming your day-to-day life. So truly, like 15 minutes a day of pooping shouldn't be too bad. The other thing to kind of keep in mind is that I usually, ideally, a poop would be something that happens after every meal. So if
3 times would make sense.
Exactly. So if you have breakfast, half an hour later, if you kind of walked around a little bit, that should help to kind of stimulate a bowel movement. But it's not the case for everybody. And it doesn't mean that you're, broken or dysfunctional if you're not passing bowel movements.
3 times a week, because it's like, it's not, one thing we all have to remember is that it's not a one size fits all.
Exactly.
That's the one thing that it's important to remember. Exactly. Now, as we wrap up, Kayla, what is the message you would like to leave for her?
If something feels off, go see somebody. And you don't necessarily have to, ask your mom or, get permission from anybody. You can book your appointment. And I know sometimes the expense is a little bit difficult, but if you have insurance,
yes,
book the appointment. And even if you just come one time, you'll get so much education and so many answers specific to you. Which could prevent years of discomfort, right? So I think that the big message is just speak up for yourself.
Yes.
Go get the care that you need and, live a good life.
I love that. Yeah. And then I thought about something as you were saying it, because what is the age that I can book my appointment independently? And what's the age that you're like, okay, I'm going to need your mom to sign off of this?
That's okay, so I'm pretty sure it's 16. Okay. If I'm not mistaken, I'd have to, look to make it 100% sure, but I'm pretty sure 16 in healthcare, you can kind of make your own decisions and you don't necessarily need a supervisor. I know in a lot of other areas, it's like this 18 years old or whatever, but if I'm not mistaken, in physiotherapy, it's a little bit younger. So that's that. And as long as, I think from our perspective as physiotherapists, if we can kind of gauge that the 16-year-old is mature enough to, advocate for themselves, and, there's a big difference between a mature 16-year-old
Yeah.
and an immature 16-year-old.
Yeah.
So I think in that case we can kind of, it's gray again.
Okay.
So yeah, sorry, that's not a super specific answer, but I think
No,
it's 16.
it's really great, because also now as we wrap up for today, and I'll say this again because even for myself, I'm sitting here and I'm like, oh my gosh, I could have so many conversations with Kayla in terms of intimacy, in terms like there's so much more that I feel like, but we can't squeeze it in the hour.
Yeah.
Or like I think the editors are like, no, it has to be 30 minutes. So I don't know, but we're gonna try and push for more. So today, as you leave us, or as we leave you, we are hoping that you felt like you were part of the conversation, that you felt like you were talking to your big sister, but also be gentle with yourself, be patient with yourself, honor your body. You deserve it. You deserve care. Ask questions, get curious, and know that approach the right people is their job. If they're pelvic physiotherapists, nothing is strange to them. So till next time, I'm your host, Gina.
If I could fly